After doing the muscles of the tongue, now we will do the nerve supply of the tongue. So tongue has got two nerve supply. One is called the motor and second is called the sensory. Motor nerve supply, all the muscles of the tongue, they are supplied by the hypoglossal nerve except the palatoglossus, which is supplied by the pharyngeal plexus through accessory nerve. Regarding the sensory nerve, tongue is having two types of the sensation. One is the special sense, that is the taste from its taste buds, and second is the general sensations. So like our skin, tongue is also sensitive to the pain, temperature, pressure and touch. So there are two types of sensations from the tongue. One is the general sensations, other they are the special taste sensations, or what is called the taste pathways. So sensory are two. Number one is the general sensation. General sensations, that is the pain, temperature, pressure and touch. And second type of these sensations, they are special. Special sense organ is the tongue, and it is for the taste. And it is different on the basis of the embryology. So there is the embryological basis that different parts of the tongue has got the different type of the nerves which carry the taste sensations as well as the general sensations. As the tongue is there, tongue has got three parts, which is divided by the sulcus terminalis. In front of the sulcus terminalis, this is the anterior 2/3 of the tongue. Then comes the posterior 1/3 of the tongue. And then comes the posterior most part of the tongue, just in front of the epiglottis. So this is the epiglottis. So there are the different type of the taste buds are present, the filiform, fungiform, foliate and circumvallate type of the taste buds, they are scattered on the surface of the tongue. And these the taste buds, they have got the taste fibers. So regarding the general sensations, from the anterior 2/3 of the tongue, these general sensations, they are carried by the lingual nerve. And lingual nerve is the branch of the posterior division of the mandibular nerve. That is the fifth nerve, carries the general sensation from the anterior 2/3. Then the posterior 1/3. So general sensation from posterior 1/3 is carried by the glossopharyngeal nerve, the ninth. And general sensation from the posterior most part of the tongue is carried by the 10th nerve, that is the vagus nerve. So these are the general sensations, how they go from the tongue to the brain. The general sensation, ultimately they reach the post-central gyres. Now comes the taste sensation of the special sense, or called the taste pathways. So as from the anterior 2/3 we have seen that general sensations from anterior 2/3 of the tongue is carried by the lingual nerve. Which is a quite thick nerve. This is the thickest branch of the mandibular nerve. the lingual nerve. So it leaves the tongue from its lateral aspect, posterior lateral aspect, and it touches the mandible just 1 centimeter medial to the last molar tooth. Then it runs in the infratemporal fossa and it goes upward in the foramen ovale. So that is the course of the lingual nerve after carrying the pain, temperature, pressure and touch sensations from the anterior 2/3 of the tongue. So this is the lingual nerve. From the posterior 1/3, these sensations, the general sensations from the smaller part is carried by a small nerve, that is the glossopharyngeal. And the general sensation from the posterior 1/3, posteriormost part of the tongue is carried by the 10th nerve, that is the vagus. So this is how the general sensations they go. Now regarding the taste pathways, or how the sensations they go from the taste buds from the anterior 2/3 is different. And from anterior 2/3, these special senses they go and they are carried by the what is called chorda tympani. Chorda tympani. Chorda tympani is the special taste sensations from the anterior 2/3. Now we will do the course of these nerve fibers, that how these fibers they go. So from the taste buds, very few fibers carrying the taste sensation from the anterior 2/3 is carried by a bundle of the nerve fibers which accompany the lingual nerve, because they want to go to the taste area of the conscious level of the brain, that is the cerebrum. And as we all know the functional areas of the cerebrum, so this is the midbrain, bones and medulla. So this is the pontomedullary junction, this is the pyramid, this is the olive. Later to the olive arises the 9th, 10th and 11th nerves. And from the pontomedullary junction arises the facial nerve by 2 roots, the motor root and the sensory root. Deep inside the medulla, there is present a taste nucleus. This taste nucleus is called NTS. That the nucleus tractus solitarius. And the taste area lies just above the lateral sulcus, just the starting of the post-central gyrus. So this is the taste area, Broadman's number 43. So the taste sensation they have to reach here, then we will came to know what we have eaten. So these small few fibers of the from the taste buds from the anterior tooth of the tongue, they accompany the lingual nerve and they come with the lingual nerve in the infratemporal fossa. In the infratemporal fossa, this chorda tympani fibers, they leave the lingual nerve just above the medial pterygoid muscle. And then these nerve, this taste fibers, now they want to go inside the NTS. For that they have to pass through the skull. So these fibers, they go to the tympanic fissure. So this tympanic fissure is present near the between the styloid process and tympanic part of the temporal bone. So this is the external catus meatus, and external acoustic meatus is closed by a membrane that is called the tympanic membrane. So these taste fibers from anterior tooth and tongue, they enter the skull through a fissure which is present between the pitro and tympanic part. This is called the tympanic fissure. Then these fibers now they enter into the middle ear cavity. And to the lateral wall of the middle ear cavity, we know there lies the tympanic membrane. So these fibers, they go medial to the tympanic membrane, touching the handle of the malleus and lies at the junction of the pars tensa and the pars flaccida part of the tympanic membrane. The mucous membrane of the tympanic cavity lies medial to it. Then after this, as these taste fibers they enter into the tympanic part of the temporal bone, so they are called the chorda tympani. Chorda means a thread or a cord. Tympani means they enter into the skull through the tympanic part of the temporal bone. So that's why it's called the chorda tympani. Now they are related medial to the tympanic membrane inside the cavity. Now it goes posteriorly, and there is a posterior canaliculus is present at the junction of the lateral wall and the posterior wall of the middle ear cavity. So somewhere here in the petrous part of the temporal bone. So nerve is now in the petrous part of the temporal bone, in the tympanum or the middle ear cavity, the posterior wall. So there is a canaliculus is present at the middle of the posterior wall between the junction of the posterior wall and the lateral wall. Through this posterior canaliculus, the nerve now goes on the posterior wall of the tympanic cavity. In the posterior wall of the tympanic cavity, running a facial canal. This facial canal inferiorly leads to the stylomastoid foramen. And this facial canal carries the facial nerve in it. Through this canal, the facial nerve descends from the roof and comes out of the stylomastoid foramen, from where its extracranial course of the facial nerve starts through stylomastoid foramen. And when we trace this facial nerve upward, So it goes into the roof of the tympanic cavity, and here the facial nerve bends. The motor part of the facial nerve is bends, is called the genu, or it is also called the geniculate ganglion of the facial nerve. So these fibers which are starting from the anterior two-thirds of the thumb, they are the dendrites actually. These dendrites, they end into the geniculate ganglion of the facial nerve, and from here the axons they start, and these axons they accompany the motor component of the facial nerve, which comes out of the pittus part of the temporal bone through the internal acoustic meatus. So these chordae tympani accompany the facial nerve, and from here, as the facial nerve enters the brain through the pontomedullary junction, as the motor root is already coming, so at the same point, the chordae tympani with the sensory root carry the taste sensations. They enter the brain matter in the what is called pontomedullary junction. So this is seventh nerve, the motor component, and this is the sensory component. So after entering the chordae tympani at the pontomedullary junction, these fibers they relay in the upper part of the NTS, nucleus tractus solitarius, from where the new fibers they start, they go into the ascend into the pons, and they ascend into the midbrain, and from the midbrain they relay in the sensory relay station of the brain, that is the thalamus, in the VPL nucleus, ventro-posterolateral nucleus, VPL nucleus of the thalamus. From here the new fibers they start, third order neurons, and they relay in the taste area number 43, situated just below the start of the postcentral gyrus or just above the lateral sulcus. So this is how the taste fibers from the anterior to the third reaches the conscious level of the brain, that is called the taste area of the cerebrum in the parietal lobe. So these are called the taste pathways. Now similarly, the taste buds which are situated on the posterior one-third of the tongue, which are mainly the circumvallate papilla. So the taste fibers also start from the posterior one-third of them. But these taste fibers, they accompany the glossopharyngeal nerve, posterior one-third. And these taste fibers from the glossopharyngeal nerve, as we know, the glossopharyngeal nerve is arising lateral to the olive in the medulla. So these taste fibers, they accompany the glossopharyngeal nerve, and they also enter into the brain, from where the nerve is coming, glossopharyngeal nerve, and they relay in the lower part of the NTS. The similar fibers they start, and the rest of the course is the same. So from the posterior one-third of the tongue also, the taste fibers they reach the NTS and taste area of the cerebrum. Similarly, from the posterior one-third of the tongue, and anterior surface of the epiglottis also. Taste buds are also present. So these taste buds, they accompany actually the vagus nerve. As we know, vagus nerve is also coming lateral to the olive, the longest cranial nerve. So these taste fibers carry the taste sensation of the posterior most part of the tongue, accompany the vagus nerve. And these taste fibers, they also go inside the brain through the exit point of the vagus nerve, and they relay in the lowermost part of the anteriors, from where the same fibers and same course as the chorda tympani, same fibers, now they reach the conscious level of brain, the taste area. So vagus also reaches it. So in this way, this is the taste pathway, that the how from the anterior 2/3, posterior 1/3, and posterior most part of the taste buds and the tongue, they ultimately reach the conscious level of the brain, that is called the taste area in the parietal lobe. If there is any interruption in the course of these nerves or damage to these nerves, this lead to the loss of the taste sensation from particular areas, depending upon the 7th nerve injury, 11th nerve injury, no, 9th nerve injury, or the 10th nerve injury. So applied anatomy is related to them. So this is how we do the taste pathways. Another important thing about the tongue is the lymphatic drainage. So lymphatic drainage is also very important. And it is very important because of the cancer of the tongue is very common in the developing country like India because of the tobacco chewing, and in the developed country because of the excessive use of the cigarette smoking, it causes the cancer of the this tongue. So lymphatic drainage of the tongue is carried by the anterior part, is carried by the submental group of the lymph node. The posterior part, the lymphatic drainage is done by the submandibular group of the lymph nodes. So just below the mandible, this is the submental group of the lymph nodes, and this is the submandibular group of the lymph nodes. And lymphatics from these submandibular or the submental lymph nodes, ultimately these lymph nodes, they go into the deep group of the lymph nodes, which are present at the junction of the internal jugular vein and the anterior belly of the omohyoid muscle. So angle between the internal jugular vein and the superior belly of the omohyoid. So there are present the group of the lymph nodes, deep cervical group of the lymph nodes. They are called the jugulo-omohyoid group. It's called the jugulo-omohyoid group. So this is how the deep lymph nodes they reach. From the jugulo-omohyoid group, these lymph nodes ultimately go to the right and left cervical group of the lymph nodes, which accompanies which ultimately form the right lymphatic duct, cervical lymphatic duct, and the left opens into the thoracic duct, and ultimately it goes into the internal jugular vein or the venous blood. So these are the lymph nodes. Now the lymph nodes from the posterior part of the tongue, that is the submental group, they are bilateral. So these lymph nodes, they are drained from the right side as well as the left side of the tongue. So due to the bilateral lymphatic drainage of the tongue behind the sulcus terminalis, it is very important for a surgeon during the cancer of the tongue removal of the lymph nodes. So we have to remove the bilateral lymph nodes of the submandibular group, because the posterior part of the tongue is having the bilateral lymphatic drainage. So during this, the tongue, the cancer is common, and there is a white plaque or patch may be found in the lateral border of the tongue. This white patch or the white plaque of the tongue represent this is called the leukoplakia. This is the leukoplakia. So this is the superior view of the tongue. This is the upper border of the epiglottis. This is the glossoepiglottic fold, and on either side this is the glossoepiglottic fossa. So a white patch is seen later, is called the leukoplakia. So leukoplakia is a precancerous condition. Leukoplakia, as it is regarded as the precancerous condition due to the excessive tobacco chewing or due to the excessive cigarette smoking, or it may be due to the tooth ulcer. A deviated tooth causes the injury of the cutting of the tongue during the mastication of the chewing. So this deformed tooth may also lead to the non-healing ulcer on the lateral border, which lead to the cancer.